Are you getting ready for spring liposuction surgery? I want to share with you 3 core tips to help you prepare and heal after your surgery so you look great this summer and minimize all the traditional post-surgical symptoms. Welcome, I'm Dr. Melissa Gallagher. I'm a naturopathic physician and I specialize as a lymphatic drainage therapist. I work with thousands of individuals post-surgically, especially in the spring and summertime. My liposuction, my Brazilian butt lift, my breast enhancement surgeries are always core on my appointment calendar because everybody's getting ready for beach season. In today's video, I want to share with you 3 tips that I offer and recommend to my patients to help them, 1, prepare for surgery, and 2, help heal quickly by reducing swelling and bruising. And long-term, you're going to notice a better effect from your surgery. You're going to get the full effect of your liposuction, Brazilian butt lift, or breast augmentation faster so that you can enjoy summer. Tip number 1, pre-surgery. First and foremost, before we even get into these 3 tips, I want to send you to check out my 18-week, 2 weeks before and 16 weeks after surgery. I have written a pre and post-surgical healing guide. I have helped thousands of post-surgical cases heal faster. And the big thing is the 2-week prep. So check out that guide. It's $14.99. It's a download. You can buy it today. Super impactful. So tip number 1, this is to help prepare you pre-surgically. Pre-surgical preparation is going to be key and it's going to be the absolute essential factor for helping you heal faster. To help prepare and minimize your swelling so you can heal faster, I want you to grab Arnica. This is a homeopathic that is wonderful at reducing swelling at the surgical site. If you are getting lipo on your abdomen, I want you to literally slather this stuff all over 2 days before your surgery. Arnica is a homeopathic that will be life-changing for you. My pre-surgical tip is this. You want to go in to surgery having applied Arnica on the surgical sites. Whatever area you are having surgery on, I want you to use Arnica all over that area. The Arnica you can actually find now. CVS, I've seen, carries it. You can find it on Amazon. I'll provide some links down below. There is a much more potent version of homeopathy. It's called Tea Relief Gel. I actually have it back over at my clinic. I don't have a sample here that I can show you, but I will include a link to my shopping cart. I have an online store where you can purchase that right here, and there's an access code for all patients. It's 6010. Tea Relief Gel is very similar to Arnica, but it has about 18 other homeopathics that speed up the healing process, minimize fluid, and really cut the bruising. Arnica and the Tea Relief Gel, they're great for cutting, bruising, and swelling. After surgery, it's gonna look like a bus ran over you. I'm not kidding you. It's going to be crazy. Some of the bruising and the deep, dark purple, almost black-like bruises sometimes stay for weeks. I've had some cases 2 months after surgery, they still look like they're fresh bruises. And in fact, if you can move your lymphatic system and get the lymph to pick up those blood cells, that will help minimize the bruising. Arnica has the power to do that. That's why I recommend that, number 1. Number 2 on my list is moving your lymphatics. So you definitely want to make sure that you find a very good, highly qualified lymphatic drainage therapist. We are few and far between. If you can't find a lymphatic drainage therapist, check out these videos. I've got a lot of DIY exercises and some dry skin brushing links and things like that that you can do this at home. But do see if you can find somebody to help you. The reason why I recommend moving your lymphatic system is because liposuction, just the technique of like moving the little wand in and removing fat cells, actually is extremely destructive to your lymphatic system. Your lymph capillaries and lymph vessels get compromised. And that's one of the biggest factors when it comes to your healing process. your lymphatic system has been completely compromised and destroyed. And it becomes really important to invigorate and move the lymphatic flow, rejuvenation and regeneration of those capillaries and vessels along as quickly as you can. Some of the different ways to do that is to incorporate homeopathy. The homeopathic that I love, I use this in all my lymphatic cases. It's called Lymph Stim. This is only available on my online store. So check that out, that link there. Because it's a homeopathic, you can actually also incorporate Lymph Stim a few days before your surgery. You definitely want to be consuming that right after surgery. It is going to move the fluid. It's going to be flushing it. It's going to also help reduce the bruising as well. But long term, it's going to help rebuild and repair your lymphatics so that you get the greatest result, the greatest byproduct from your surgery. The dosing on Lymph Stim right out of surgery is you want to be consuming 35 to 40 drops 3 to 4 times a day. Most of my patients will actually buy this in my online store. I think it's $49 you have to hit for free shipping. They'll usually buy 2 or 3 bottles of this. This is a lot. It's 4 fluid ounces, but you're going to be using a lot of this fluid to move your and flush your lymphatics. So it is good to stock up on this, but I never go out in my store. So you'll always find it available. It's shipping right off the line, and it is going to be highly potent for rejuvenating your lymph and flushing out fluid that your body's going to be holding on to by nature of liposuction. The third and final recommendation actually has to do with managing pain. When it comes to pain, a lot of times your plastic surgeon's giving you just a little bit of pain meds. But I want to share with you an option that is natural and extremely powerful to alleviate post-surgical pain. And this is for lipo and every other type of pain. Topically, not only do we incorporate the Arnica and the tea relief gel, but to really resolve that super nerve related pain, just to dull it out so you don't feel it. And this is great when you're preparing to put on your compression gear. CBD cream. CBD cream is my solution for pain relief, and it is so powerful. I have all different types of patients utilizing this. This is super powerful. I sell this in my online store. This is a 44-gram dose. It's this really thick, very mentholy related cream. You will put it on topically on all the surgical sites. You want to make sure that you don't apply right on an open wound. But if you have already the incision sites, they've healed and they're scarring, that's where you're going to get a lot of the pain. If you had drains too. So here's a big bonus. If you had drains put in, the removal of drains is awful. And a lot of times doctors don't recommend you take any pain relief like an Advil or naproxen sodium. Put this cream, literally a few dabs of this, right on the skin where the drain is, not on the opening of the drain. This will infuse right on in, and when they pull them out, you won't even feel it, I promise. And that, honestly, some of my patients say that's like the worst pain ever. But there are 5 levels of this cream. Post-surgically, I want you to look at level 4, severe. Okay, so this is what you're gonna use. Most of the time, you're only gonna need that for about a month and a half to 2.5 months, depending on if you're doing all the right things, depending on a lot of factors, your diet, implementation of these recommendations. One of the biggest complaints that I get from patients who are just right off of liposuction surgery is the pain. It is excruciating. It's a burning pain. And then it's painful because you're being compressed in compression garments that you absolutely have to wear. Watch this video for more information about that. But you do have to wear those. And the more that you wear them, the longer you wear them, the better and faster your healing process is. The more fluid we're reducing and we're managing your healing process so that you can get the full effect. Also, one thing to know, as your nerves are rejuvenating and regenerating, and you go from, sometimes there's a dull, nummy pain. Depending on your case, your surgeon, the incision sites, some folks don't experience pain until a few weeks later. So sometimes they're literally just numb. And then as the nerves are rejuvenating, that's when they start to feel like lightning kind of strike pain and really intense nerve pain. you can start to use that cream at that point where we go from numbness to like really sharp burny pain. Then there's this transition from burn and itch. It kind of burns and itches at the same time, which is awful. And then we go into the itching, and then we just go into no pain at all. That's that kind of healing process that you're going to experience when it comes to pain. So the CBD cream you can use as frequently as you prefer. Most of the time I find that 3 or 4 hours, sometimes 6 hours is the time you want to redose yourself. But just a little bit goes a long way. It's menthol and camphor smell. It's just so wonderful. But that is huge. I found incorporating that in my practice in the last few years has been extremely beneficial. So I hope you'll check it out. And again, all links, all information that I recommend is down below in this description box. Links to my online store are there as well. And again, don't forget, if you're a new patient in my store, access code 6010 is what you're going to need to use. Thank you for tuning in. If you're new to my channel, I hope you will subscribe. I produce videos every Tuesday and Friday. I talk a lot about hormone balancing, digestive health, and lymphatics. I hope you'll join my community here and follow me outside on Facebook and Instagram. Thanks for inviting me into your life. I hope you have a wonderful, happy day.